Research by physicians, nurses, and unbiased medical providers have demonstrated over and over again that advanced practice nurses have been providing high quality and cost-effective APN care for over 4 decades, which is 48 years. There is extensive and consistent evidence that nurse practitioners provide care of equal or better quality at a lower cost than comparable services provided by others. We do urgent care.
So I guess what would be the difference between your training and what a primary care physician would need to be in order to be classified as a primary care physician?
They're identical. The primary care and family practice nurse practitioners training are very similar. And when you look at the quality outcome studies, there's no difference.
I mean, my concern is that I think that there are systems there right now where we can have collaborative physician arrangements where we have the physician that is the leader of the medical home, that we can have the nurse practitioners, the PAs, the nurse educators, everybody else that we need there to do it, and be able to expand that, hopefully with what some of the new things that are coming out, to more and more areas. We've also, with Medicaid, we've just had an increase in the amount that primary care physicians are being paid by Medicaid to bring us up to Medicare levels. I think that there are opportunities to do that. I don't think we should be naming a nurse practitioner the head of a medical home. That's our concern.
Representative Ferguson, you recognized for question.
In Arkansas now, does any insurance company recognize APN as a medical centered home or a gatekeeper?
To my knowledge, the 21st century patient-centered medical home that we're piloting in the 69 clinics, that's really the cutting edge of where we are on the team-based care, and none of those are led by a nurse practitioner.
As you see behind us, we have a number of medical students here from the University of Arkansas that are going to go into family medicine. This bill discourages the investment that they're going to make into family medicine and primary care and internal medicine by basically equating a lesser training and lesser education with the sacrifice that they're going to make.
Representative Ferguson, you're recognized.
I do think it's an important distinction in the training. I mean, maybe some other people can address the nurse practitioner. I mean, I know that to be a nurse practitioner is a wide variety of training, but what I try to tell people, it's like saying we have a problem with science and math teachers in rural areas, so we're going to let teachers' aides with a high school diploma go teach math and science in rural areas. It's the same disparity in education. Would you agree with that?
Yes, ma'am, I would. You know, analogy that's maybe overused is the captain of the ship. You know, the first mate is an integral part of the team that runs this ship, but the ultimate responsibility is to the captain. And the healthcare team, the ultimate responsibility should be with the physician.
It's been stated that that this bill does not raise the scope of practice for nurses, but it definitely leaves the potential for it changes. The nursing board has only one nurse practitioner. There are other members of the nursing board that could very easily expand the practice, the scope of practice for nurses, and we really don't think that that's the proper thing to do. So again, Dr. Thompson has mentioned the studies that have been done. When I was in the General Assembly, I had an interim study looking at some workforce issues. This has been continued and studied extensively, and none of the studies have shown that making APNs primary care providers would increase access or improve care in Arkansas. So I strongly urge you to vote against this bill.
Now the problem with Medicaid, and you may want to ask someone from Medicaid to come up here, because it's been stated that Medicaid has refused to pay them for things that they believe are within their scope of practice. In each of those discussions, they have gone to the nursing board for help, and that has created more problems, and it'd probably be best for Medicaid to address that, But the nursing board, because they are comprised primarily of LPNs and RNs, lower down on the level than APNs, they have come back with recommendations that APNs could do colonoscopies, for example.
I am Dr. Darlene Bird. I am an advanced practice nurse. I'm certified as a family nurse practitioner. And
this issue is not about the quality of care provided by advanced practice nurses. We're not here to contest that. It is the role that an advanced practice nurse and other physician extenders should play in the healthcare system. I couldn't agree more with what Representative Hammer just said, and that is that we need to let advanced practice nurses and physician assistants take care of a lot of patients that don't have problems that need to be seen by a physician. But we believe strongly that that physician needs to be there for when they do need to see the physician. And what this bill does, it takes the physician completely out of the mix. Then we move to the scope of practice issue itself. And this is where the real problem is. The provision in the current bill sounds great, but here's the problem. This is the Nursing Board Rules and Regulations for Advanced Practice Nurses, Chapter 4, Section 1, Scope of Practice. In accordance with the scope of practice defined by the appropriate national certifying body, the Nursing Board's own rules have deferred their authority to these national certifying bodies for which you have no control or authority over. And that is the crux of the problem with the scope of practice of APNs.
good morning. My name is Dr. Darlene Bird. I am an advanced practice nurse, and I have been working with Marilyn Strickland honestly since 2004 in regards to these CPT codes. I'm Dr. Darlene Bird. I'm an advanced practice nurse with Arkansas Nursing Association.
Thank you, Mr. Chair. I just want to clarify something you said, or make sure I didn't misunderstand something. Is the medical society proposing to tell the private insurance companies how much they ought to pay somebody that they recognize as being skilled and to the competency of their ability and within their scope of practice? Are you proposing, did I misunderstand you, that you're telling insurance companies what they ought to do or not do as a medical society?
No, actually, that's what this bill does.
There's a reason that nurse practitioners are paid less, and if the point is to save the system money by hiring nurse practitioners to assist physicians, then as David Roten said, what's the point of going to medical school to be a family practice doctor if you can go to APN school and do the same? And the training programs for APNs is sort of all over the page, and certainly not the rigor and exposure that family practice medicine people get. So to say that they should be compensated the same as someone who goes through all that medical school and residency is just, I think, unreasonable.
So I'm coming from this from the aspect of a physician, and I'm here today to speak for the patients in this state that need this. I see this as a practicing physician, and you can talk to any physician in the state. We see this every day in our practices. We see people who don't have coverage, and Arkansans are proud, and a lot of times because of their pride and their lack of access to the finances of health care, their lack of access to insurance, they wait, and they'll put off their health care decisions. And I can't tell you the number of people I see. I treat patients with diabetes and diabetic retinopathy, and it's one of the most preventable causes of blindness that we have, but it's also one of the leading causes of blindness. And the primary cause is because some patients, because of their lack of ability to access care or their pride, they don't have a means of paying for their care, they just don't come to the office. So you take someone that works, and it's a very insidious disease. If only we had the ability for that person to access health care. We had a young lady here that testified, I don't remember, 3 or 4 weeks ago outside, was 52 or 54 years old and had breast cancer. She lost her job. She was divorced, lost everything that she worked for in her life, and all because of a system that could not help provide her care. You know, families, we have families in this state that because of uncertainties in their employment, they're forced now to choose between putting groceries on the table and buying health care insurance. This is a chance for Arkansas, for our little state of about 3 million people, to lead this nation in a program that, if it falls apart in 3 years, we stop it. But if it works, this could transform the delivery of health care across this entire country. Just let me leave with this from Matthew 25:40. And I say to you, whatever you did for the least of my brothers, you did for me.